Okay, so thank you guys all so much for having us today. It's really nice to be able to talk about the Ontario Senior Dental Care Program. So I thought we could start by just doing a really brief introduction because the three of us actually all work in different areas of the region. So I work for Bridges Community Health Center in Fort Erie, Port Colborne, and Wainfleet. And then if any of you feel comfortable, we thought it would be nice to hear an introduction from yourselves and the role that you play in the Rotary of Fort Erie.
I'll go first. I'm Shannon, and I work for Quest Community Health Center in St. Catharines. It's on Queenston Street, and for any of you that are familiar with St. Catharines, it's across from where the old St. Catharines General Hospital used to stand.
And my name is Alicia. I am a dental health community worker in the Niagara Falls area. I work at the Niagara Falls Community Health Center. So we're at Victoria and Morrison. Back in the day, it used to be a Scotiabank, and then it was a Canadian Tire. So now we're here at the Community Health Center.
Perfect. Okay, I think we're ready to start. So thank you so much for allowing us to be here today to talk to you about the Ontario Seniors Dental Care Program. Otherwise known as the OSDCP. So the OSDCP targets individuals with low income and without access to dental insurance by providing them with access to free quality dental care, which in turn helps our seniors stay healthy longer and keep them out of the hospitals. Now, this may not be a direct concern specifically to you being professional leaders in our community. However, you may know of a neighbor, a family member, or a friend who's struggling with oral health issues and without the means to seek dental care. With the recent pandemic, many individuals involved in the promotion of this somewhat new program we launched in 2019 in November, people in the program have been transferred to other areas working on the pandemic. So the advertising for this program has been halted, to say the least. A large responsibility as dental health community workers takes us out into the community, providing presentations such as this, and also allowing us to connect with older adults that may qualify and getting us out there sharing the news of this wonderful program and assisting folks with the application process. We are here today to let you know about the Ontario Seniors Dental Care Program in hopes that as connected professionals in the Fort Erie community, that you may share this information and possibly be able to help a senior receive the dental care that they rightfully deserve. This Ontario Seniors Dental Care Program operates and is available through public health units, Aboriginal health access centers, some mobile dental clinics, as well as community health centers across the province, which brings us to our next slide. Perfect. So CHCs. For those of you that aren't familiar with community health centers, CHCs are not-for-profit charitable organizations. So basically they focus on keeping people well and not just treating them when they are sick. Community health centers deliver primary healthcare services in combination with health promotion and illness prevention services. They are governed by community members working hand in hand with those that they serve. Community health centers' priority is improving the health and well-being of populations who have traditionally faced barriers to accessing health services.
All about Bridges, among other things, to represent.
They have been around for a long time now. So they started in the 1920s. There are 74 across Ontario and actually 5 in this Niagara region, which includes the centers where we, your presenters today, work. Next slide, please.
So, dental health community workers, I bet you all had the question, what is a dental health community worker and what can we do for clients? So what we do, part of our role is that we assess eligibility for those who are 65 and over to see if they qualify for the Ontario Seniors Dental Care Program. So we'll talk more about that in the presentation. For those who are not quite 65 yet and still needing dental navigation, we work with all ages. So whether that might be a parent who needs assistance setting up their child with healthy smiles, and even those who don't qualify for the seniors program, seeing what other community resources or programs are available that they can also access. Another part of our role is reducing transportation barriers to dental care within Niagara region. So many of our clients face various barriers, whether that might be a physical barrier or even a financial barrier that prevents them from getting to and from their appointments. So as dental health community workers, we will assess the client to see what transportation services they might qualify for, whether that might be Red Cross, Niagara Specialized Transit, or even Chairvan. And we will assist that client getting their application set up and also faxed off to the correct appropriate people. Another part of our role is our denture accessibility. So for those who don't qualify for the seniors program, but still needing dentures, we again help support those and see what available resources and community programs that they can access. And so one of them might be the Brush to Side program, and it's a loan program for those who are needing dentures or even extractions completed. They will provide the loans for that. So we will work with the client to see what programs that they can access within their area. Another part of our role is that we help evaluate the social needs and the health of all clients and connecting them with community resources. I like to make sure when speaking to my clients, besides dental, are there any other supports that you are needing to help with your activities of daily living? I had one client who came in who thought she was coming in for just a dental application. At the end of the appointment, we were able to connect her with our dietitian here. We were able to connect her with counseling support, and all of our programs and services at the community health centers are free. Last but not least, we assist and support clients with oral health education. So every year in April, we celebrate Oral Health Month. So the dental health community workers and I, we put together a social media information page, and it talked about various health topics such as smoking and oral health and how that relates. We also talked about our registered dental hygienists and how important they are to the world, and also the tips and tricks how to maintain good oral health. So we provided that information to the community, and we had a great response to that. So those are some of the oral health education that we would provide to the community. So with the Ontario Seniors Dental Care Program, like Shannon mentioned, it started in 2019. And I was reading an article, and it talked about two facts on why the government implemented this program. One of them being that every year in Ontario, preventable dental issues such as gum disease, chronic pain, and infections led to more than 60,000 emergency department visits, and a good portion of them were the seniors. So with the OSDCP, it will provide free dental care for those who are 65 and over. It will help reduce unnecessary trips to the hospitals, prevent chronic diseases such as diabetes, arthritis, and heart disease, and much more. And last but not least, increasing the quality of life for seniors. Because another fact that they found with this program is that people who do not receive routine dental care, it not only affected their oral health, but their overall health that impacted their quality of life.
So now that we've talked about the Ontario Senior Dental Care Program, let's talk about who's eligible for it. So you have to be 65 or older, you need to live in Ontario, and it is income-based. So you need to have an annual net income of $22,200 or less for a single individual, or $37,100 or less for a combined income for a couple. And you also can't have access to any other dental benefits. So that would include ODSP, Ontario Works, or any private dental insurance. And so what is covered under the Ontario Senior Dental Care Program? This program covers both preventative and restorative services. So preventative such as checkups, cleanings, oral cancer screenings, x-rays, and then restorative like repairing broken teeth, extractions, treating infection and pain, treating gum conditions, diseases, and it also will provide a copay on dentures. So what that means is dentures will be covered partially by the program, and the individual would only have to pay up to $80 for dentures. So much more affordable dentures. And in our experience, most people we come in contact to do need some sort of dentures if it's partial or full.